The following story is fictitious, and although based on possible outcomes of poor medication administration, it does not depict any actual person, residential aged care facility, or real event.
So Mrs. Walker's death is recorded at around 10:02. Do you know if she hit her head before she fell, or would it be the other way around?
Look, nobody saw her fall. Jenny found her on the floor this morning when she was delivering her laundry.
Excuse me. I found these pills in Mrs. Walker's room.
Why would she have pills in her room? Was Mrs. Walker self-administering?
Absolutely not. None of the residents here self-administer their medication.
So if that's the case, what were these doing in Mrs. Walker's room? Could Mrs. Walker's death have been caused by her not taking her medication?
I'm Jo Boylan, the Director for Operations at Southern Cross Care in South Australia and the Northern Territory. I've spent over 25 years in the aged care industry, working on everything from policy issues to advising government departments on a range of issues affecting the aged care sector. In today's program, we aim to help you to understand what you can and cannot do when it comes to medication administration. We'll look at the roles and responsibility of the three people involved in medication administration: you, the care worker, the registered staff or RN, and the older person. We'll then demonstrate how to safely assist an older person with the administration of medication. You need to know that medication is governed by Commonwealth, state and territory legislation and guidelines. Your care home's policies and procedures have been specifically designed to comply with all of those guidelines and standards. That's why it's important for you as a care worker to follow your organisation's policies and procedures when assisting with medication.
So what is your care home's responsibilities when it comes to administering medications?
Look, this folder sets it all out very well. Our staff follow the policies, procedures and all the guidelines for medication management and medication administration. They're relative of current legislation, industry standards and guidelines.
Okay, I'm going to need a copy of this.
Look, you can just have that one. We've got plenty of those.
All right, thank you.
So how do you record what meds Mrs. Walker was taking?
Well, we've got medication charts and they're heavily monitored. We check the charts and make sure that all the updates are attended that have come from the doctors, the dentists and other appropriate health professionals.
Such as?
Such as when and how a medication is given to a resident or received by a resident. There can also be a medication change for a resident.
So who actually administers their medication?
Whoever's delegated the task.
And do these staff members receive any training?
Absolutely. I know in some organisations the role of medication administration is wholly and solely the registered nurses. They have to make sure that they keep their professional practice very much up to date. In this facility, it could even be delegated to credentialed care workers.
So how are care workers selected?
Look, we look at our staff, we look at all the carers that we do have on staff, and we try to look at people who we think are most suitable for medication administration. And this involves a very stringent training program for them, and also a very stringent assessment of their work and evaluation. And until they've done all of that, they can't be credentialed, but once they are credentialed, then we can deem them competent in medication administration. However, that's not the end of it. We do have to follow up and we do have to monitor their progress afterwards.
Okay.
The responsibility of an aged care facility doesn't end with maintaining medication charts and training staff. They must also provide you with the equipment and resources in good working order, such as pill crushers and trolleys, and the resources that you need to safely administer medication. Suitable spaces also need to be set aside to store and secure medication and equipment.
This is the medication room where we keep all the medications.
Okay.
Sue, this is Detective Cowan and Detective
Hello.
Melrose.
Nice
to meet you.
Sue's a registered nurse here,
Okay.
and she's in charge on the shift today.
Sue, I need to ask you, is this door kept locked at all times?
Yes, when nobody of authority's in here, the door's locked.
And how many other people have a key to this room?
The RN and the senior carer.
Okay.
In Australia, the law classifies drugs and poisons into schedules. All drugs used in Australia fit into one of 8 schedules. Schedule 2 drugs like Panadol and ibuprofen are generally available to the public at pharmacies and supermarkets. Schedule 3 drugs like Mylanta and Ventolin can only be sold by a doctor or pharmacist after the buyer has received professional advice. Schedule 4 drugs can be bought in pharmacies but only with a prescription and are considered restricted substances. They're labelled prescription only. Prescriptions for Schedule 4 drugs like Panadine Forte, temazepam and Valium can only come from a doctor, dentist or an authorised professional. Likewise, Schedule 8 drugs can only be prescribed by a doctor, dentist or an authorised professional. Schedule 8 drugs are control drugs or drugs of addiction and include medicines like endone, morphine and pethidine. Schedule 8 drugs must only ever be administered by a doctor or an RN.
I think we're all done in here for the moment. That's okay.
We're going to need a copy of Mrs. Walker's medication chart.
Yes.
Yeah, that's okay. I'll get you a copy of the care plan as well.
All right,
you.
thank you.
Thanks.
Yeah.
Look, we're also going to have to speak to the last person who gave Mrs. Walker her medication.
That would be Amy Martin.
Okay. Is she a registered nurse?
No, she's a credentialed care worker here.
Is Amy around today?
Yes, she is. I can organise for her to meet with us, if that's okay with you.
That'd be great. Thank you very much. That's great.
Thank you. Yeah.
I'll go and
If
organise
Mrs.
that.
Walker had not been taking her prescribed medications, she may have become disoriented and weak.
It's all right with you. I'd like.
Hi. My name's Detective Damien Cowan. Nice to meet you.
Likewise, I'm Amy.
Amy, you know that Mrs. Walker passed away this morning?
Yes, I was aware of that.
Okay. We found these medications in her room. Any reason as to how or why they'd be there?
Like everyone, the older person has rights and you need to understand those rights. For example, they have the right to give informed consent for any treatment, including taking of medication or having any medication administered to them. That means the older person has every right to refuse medication.
Can you just clarify what rights people like Mrs. Walker have in regard to care facilities and their medication?
Firstly, they have the right to regular medication reviews. Secondly, they have the right to representation from a carer, relative or guardian, particularly if they can't give consent.
They have the right to confidentiality regarding their medications, and they also have the right to know everything about the medications that they're taking.
Could Mrs. Walker have refused to take her medication?
Yes, absolutely. I mean, she has the right, but she didn't refuse though. If she had refused, I would have noted that in her chart.
Okay.
Registered staff determine who should provide help to the older person under their care. This means that it's the registered staff's responsibility to decide who, if anyone, they delegate medication administration to. Delegation in nursing is defined as transferring authority to a competent person to perform a select nursing task in a select situation. For example, the registered staff may delegate medication administration to enrolled nurses and credentialed care workers at their facility. However, some organisations' policies and procedures may dictate that only registered staff can administer medication. And some types of medication, such as Schedule 4 and 8 drugs, can only be administered by registered staff. Registered staff develop, amend and keep medication charts up to date by liaising with medical officers and pharmacists. They also check all administration aids. Registered staff also facilitate conversations between doctors, families and older people regarding medication management issues. They should refer to medication management and pain management programs in the Advanced Practice Library for further information.
So, what's the role of the registered staff here? It seems like the care workers cover an awful lot of ground in terms of medication administration.
Yes, they do. What the care staff do is vital. However, what you need to remember is there are 7 important steps in medication administration delegation. This can only be attended by the registered staff here.
And they are?
Well, if you'd like, I'll give you a copy of them.
Okay.
There you go.
Thank you.
Well, first of all, the registered nurse has to identify the task. And secondly, you have to find the most competent carer to attend the task.
A credentialed care worker?
Exactly. Once you've identified that person, then you have to clearly communicate to that carer what the task is and what the goals and objectives of that task are. You also have to establish a time frame for them to complete the task. You also have to monitor the progress of the job to make sure that the job's actually being done. And you have to, very importantly, provide guidance for the carers. That's extremely important. And once the task is completed, well, then you have to assess their performance and their accomplishment of the task that you gave them.
So, Amy, did you understand what was communicated to you by Sue this morning? She's the RN in charge, right?
Yes, she was. And yes, I'm very clear on what my roles and responsibilities are when assisting with medication administration.
Is it the same in all care facilities?
No, the role and scope will vary from one organisation to another.
Credentialed care workers cannot work outside their scope of practice, as outlined in their job description, to do tasks that they have not been assessed by a clinical educator as competent to undertake.
Oh, okay, I'm not actually able to help you with that. You'll have to speak to the RN. She's around in the nurses' station if you'd like to have a chat.
Okay, thanks, Mel.
See ya.
The care worker should always receive clear communication, especially when they are being asked to do something not normally part of their daily tasks. Where a care worker is involved in doing medication rounds, the times and guidelines are set by the facility.
Amy knows to expect audits or inquiries from the RN or myself regarding her management of the medication rounds.
I'm always provided with guidance in medication administration, and if I don't completely understand something, then I seek advice. Look, I know my competency to administer medication. It's going to be assessed annually, and I'm good with that.
So, as a credentialed care worker, tell me, what does that mean when you're giving out medication?
Well, I would observe the resident's condition before, during and after medication administration, and, well, I'd report any anomalies to my supervisor.
But how do you know what to give?
I follow the medication charts and our policies and procedures when assisting in medication.
Is that it?
No, I also complete all records like medication charts and progress notes. I report to my supervisor and tell them if anything strange has happened.
Strange?
Yeah, like if someone refuses to take their medication, then that's something I would definitely report.
So Amy is a credentialed care worker. How did you come to choose her?
Well, Amy was one of the few selected. I mean, it's not a job that's for everyone. And we had another candidate for the job, but she didn't want the responsibility, so she refused the job. and she's got every right to do that.
Care workers always have the right to say no when asked to do things they are not comfortable with. They should never perform a medication administration job that is outside of their training or job description.
So, how do you know when to give the residents their medications?
Oh, well, we're given set times. This is the blister pack that we use, which is the dosage administration aid. And this will tell me the times of the day when the medication should be given. And here, it correlates with the medication chart here. I gave it at breakfast, and as you can see there on that chart, it's breakfast time.
Okay, I can see that.
Don't some medications have serious side effects?
Absolutely. But Amy knows that she has to report any change in a resident's condition to her supervisor.
Some medications have more than one name. For example, on a medication chart, paracetamol may be called by the brand names Panadol, Panamax, Dimedon, or it may just be called paracetamol.
So, Amy, talk me through, in as much detail as you can, how you administered Mrs. Walker's medications this morning.
Sure, but first I just should explain to you that in my care home we use something that we call the 6 rights. That means the 6 rights of medication administration, and we follow these every time we give meds. So that's the right person, the right drug, the right amount, the right time, the right route, the right documentation.
Wow, that sounds pretty full on. And you do this every single time you give medications?
Yeah, every single time. That stops mistakes.
Okay. So getting back to Mrs. Walker, what happened when you arrived in her room this morning?
Well, I came in, I said good morning, I asked how she was feeling, I then washed my hands and then asked her if she was ready to take her tablets.
Okay, so that's when you did the first R, right person.
Yes.
How did you know it was the right person?
Well, I asked Gwen for her date of birth and then she confirmed that she was Gwen Walker, that she was born the 23rd of January 1951.
Why didn't you just ask her if she was Gwen Walker?
Well, we're not allowed to ask yes or no questions.
Oh.
You see, if it's an older person with memory loss, they may simply say yes without understanding the question. And look, even though I know her by sight, I still compare the photo on the medication chart with her, and I also check to see it's her name on the blister pack, and there I can also find out whether she's allergic to anything.
What if her photo wasn't clear?
Well, I'd check her identity with another staff member.
Okay, so next R, right drug. Tell me about that one.
The label on the older person's medication, in this case a blister pack, should be checked against the medication chart or signing sheet to ensure you are giving the right drug to the right person. Check also that the drug has not expired. Blister packs come in 2 types. The first is a pack where each drug has a separate compartment. In these types of blister packs, colour coding is used. For example, pink indicates morning medication, yellow lunch, orange dinner, and blue for bedtime. The second type of blister pack will have all the morning tablets in one compartment. The next compartment will have all the lunch tablets. The next, all dinner tablets, and so on. Credentialed care workers may also be asked to administer sachets. Each sachet will contain all of the older person's medications for a certain time. For example, one sachet will have all the morning medications, another the lunch medications, and another the dinner. Checking the right drug also means checking that if the medication chart says 4 tablets, then you give 4 tablets, either from a blister pack or a sachet. When it comes to the administration of non-packed medications like eye drops and liquid oral medications, ensure the label on the bottle matches the medication chart. And always check medications are within their use-by date. Eye drops, for example, should be discarded 1 month after opening. If you're the first person to open eye drops, make sure you write the discard date on the bottle. Remember, some topical medications like creams may be written on a separate non-packed medication chart, so don't forget to check these charts.
So you just gave her the medications out of these blister packs?
No, I also gave her some liquid medication.
So how do you know how to judge the right amount for Mrs. Walker?
Well, the right amount is always the amount that's prescribed by the resident's doctor. With liquids, I measure it out in a clean medicine cup. I put it on a flat surface, squatting so that my eyes are level with the cup, just to make sure that I'm giving the right amount that's on the chart.
Okay. So you've measured her medicine, you've checked her dose. What next?
The right route.
Who decides what the right route is?
The route of medication administration is always prescribed by the doctor.
All care workers who administer medications know that medicines come in many forms. The form of the medication may determine how it is to be administered. For example, tablets, liquids and capsules are taken orally, while lotions and creams are applied on the skin. Then there are powders, eye drops, nose drops, sprays, gases, patches, pessaries, wafers, injections and suppositories. Always seek advice on the correct administration of any form of medication you're unsure of.
So how do you check the right route?
Well, I check what's written on the chart and her medicines to make sure of how they need to be administered. If it's an oral medication, I need to see if it needs to be crushed as per the pharmacy order.
Were Mrs. Walker's medications crushed?
No, they weren't.
Okay. Do you give injections?
No, I'm not allowed to give injections.
In our facility, we don't allow the care workers to administer injections. I know in some of the care homes, the credentialed care workers are allowed to use the insulin pens, but we don't allow it in our facility.
Okay, so what else don't you allow the care workers here to do?
Well, part of the care workers' training is to know not only what they can do, but what they can't do. So they're not able to assist with the more invasive methods of medication administration, such as rectal or vaginal applications. And of course, they are not allowed to administer Schedule 8 drugs.
What about the fifth R, the right time?
Well, the right time means checking the medication chart to see what time the doctor has specified the medication to be taken. And I also check my watch to make sure that I'm giving the medication at the right time.
All right. I noticed on the medication chart all these abbreviations. What does Manny mean?
Oh, that's Mane. Means in the morning.
Okay. Nocti, how do I say that?
You say that nocte, and that's at night.
All right. And what about BD?
BD means twice a day. TDS means 3 times a day. QID is 4 times a day. PRN means as required, and STAT means immediately. And look, we have a list of abbreviations at the facility, so if I'm ever in doubt, I can use that as a reference guide.
Okay, so what's the last R?
The last R is the right documentation.
Documentation may include medication charts, signing sheets and progress notes. You need to document that the medication was observed to be swallowed, taken or applied appropriately. Also document if the medication was refused by the older person or withheld after consultation with a health professional, or if there were difficulties with swallowing or changes in the older person's condition, or reactions to medications, complaints of side effects and adverse reactions to the drugs. It's also vital you document any medication errors or near misses.
So when I document on the medication chart or signing sheets, I use symbols and then I circle them. So, for example, like on here. So A is absent, F if they're fasting, L if they're on leave. N if the drugs are unavailable, R if they refuse their drugs, S if the older person's self-administered, and W if the drugs are withheld.
If you sign the medication chart or signing sheet, you are confirming that you have witnessed the older person taking their medication. When signing charts, remember to circle the symbols because it distinguishes them from your initials.
So that's it then, the 6 rights.
Well, almost. It's standard practice to do 3 checks before giving medication. So that's one before I pop the pills out of the blister pack, one after I've popped them out, and then once before I hand the pills over. And then I do the final check, which is the right documentation. So with that, I fill in the signing sheets and then the progress notes if that's necessary.
Okay. So do you remember what you wrote on Mrs. Walker's chart this morning?
I didn't write anything, I just signed it.
So let me get this straight. You checked the right person,
I did.
and then you checked the right amount,
That's it.
checked the right route,
I did.
then you checked the right time.
Yes, that's correct.
Did you notice if Mrs. Walker had any trouble swallowing her pills? Swallowing her pills? Swallowing her pills? Swallowing her pills?
That's it for me now, Gwen. I'll see you at lunchtime, okay?